So if you've ever felt like your body suddenly lost its grip or just changed completely down there after going on the pill, and your doctor told you everything looked totally fine, I need you to know you aren't going crazy.
No, absolutely not. And it's such a common experience, but it sits right in the middle of this massive diagnostic blind spot in modern medicine.
Right. And that's exactly why we're here today. Welcome to the Deep Dive, where our mission is to answer a surprisingly controversial question. Can hormonal contraception actually make vaginal laxity feel worse?
And, the answer involves a physiological plot twist that most people, well, most doctors, even just never see coming.
Yeah, it's wild. To get to the bottom of this for you, we've pulled together a really fascinating stack of sources. We're looking at the latest clinical guidelines from the Faculty of Sexual and Reproductive Health Care.
Hmm.
We've got some incredibly dense research on the biomechanics of the pelvic floor, and also on-the-ground insights from specialized pelvic health physiotherapy clinics.
Which are so crucial because they see what the patients actually feel day to day.
Exactly. So the short answer to that big question is yes, birth control can absolutely make laxity feel worse. But the reason why isn't structural at all. It's chemical.
Yeah. And before we can really blame birth control for causing laxity, we have to start by completely redefining what we even mean by the word laxity.
Because the medical definition is completely different from what a patient is feeling, right?
Right. If you walk into a doctor's office complaining of looseness, the physician is immediately looking for a structural failure. They're looking for pelvic organ prolapse or POP.
Which is, just to be clear, when the organs are physically dropping down.
Yes, it's an anatomical descent. The bladder, the uterus, or the rectum are physically dropping down into the vaginal canal, and doctors can measure that physically.
Right, there's an actual system for it in the clinical literature, the POPQ system, where they can literally map out the descent in centimeters.
Exactly. It's visible, it's undeniable, it's kind of like looking at a broken bone on an X-ray. But laxity, on the other hand, is fundamentally different. Laxity is primarily a sensation. A sensation. So it's not something they can just measure with a ruler.
No, not at all. It usually presents as, feeling less responsive during intimacy or maybe like a friction or even just a vague, unsettling sense of feeling less held or supported during high-impact activities.
Like running or jumping or something.
Right, which means a person can feel incredibly loose. They can experience really distressing laxity without having any measurable prolapse on an exam.
Wait, and conversely, someone could have a measurable prolapse but feel no laxity at all.
Exactly. It's totally possible.
So, okay, if we think about the pelvic floor as a hammock holding up your organs, prolapse is the hammock physically drooping toward the ground, right? The ropes have stretched, the whole structure is sitting inches lower.
Mm-hmm.
But laxity is more like the actual fabric of the hammock losing its weave. Like it feels less supportive, it's thinner, even if it's hanging at the exact same height from the trees.
That is the perfect analogy. The structure is in the correct anatomical position, but the material itself has fundamentally changed. But I guess the problem is that when a patient with a fabric problem goes to a doctor who is only looking for a height problem.
They get told everything looks perfectly normal.
Wow. Okay, but I have to push back a little here. If the muscles aren't actually drooping, if that hammock is hanging at the exact same height, how does a change in just the fabric cause such a profound sensation of looseness?
Well, the sensation of laxity is driven almost entirely by tissue character. And that character is heavily regulated by one master hormone, which is estrogen.
Estrogen.
So,
Yeah.
yeah, the entire urogenital system. So the vagina, the vulva, the urethra, the pelvic floor tissue, it is all densely packed with estrogen receptors.
So they're just waiting for that hormone to tell them what to do.
Exactly. And estrogen's primary job in this specific region is to maintain the thickness, the elasticity, the blood flow, and really just the overall plumpness of the tissue.
Okay, so it's building the hammock's fabric. And based on the biomechanical research we looked at, it's doing this by manipulating specific proteins, right? It synthesizes type I and type 3 collagen.
Yes. So type I collagen acts like steel rebar. It provides that rigid structural integrity and strength.
Okay, and type 3?
Type 3 acts like bouncy rubber bands. So that provides the elasticity and the snapback quality. Estrogen keeps the production lines for both of those proteins running at full speed.
Right, so estrogen acts like this anti-aging serum and structural manager for the pelvic floor. It builds the good stuff.
It does, but it also plays a crucial defensive role. It actively suppresses a group of enzymes called matrix metalloproteinases, or MMPs.
Matrix metalloproteinases. With a name like that, they sound destructive.
They really are. They're basically microscopic biological scissors.
Okay, so if estrogen is suppressing them to protect the tissue, they must be the enzymes trying to break the collagen down.
You got it. Their sole purpose in this environment is to eat away and degrade collagen. So when your estrogen levels are high, your tissues are supple, they're thick, they're highly responsive because those MMPs are kept in check.
But when estrogen drops,
Collagen production slows down, and those biological scissors are basically let loose to degrade the tissue. It becomes thinner, drier, and it completely loses that crucial elasticity.
it loses its stretch and its grip.
Oh,
Which brings us right to the door of systemic contraception.
exactly.
Because if estrogen is the master builder keeping those biological scissors in check, any disruption to that hormone is going to cause a structural collapse.
Right. And most hormonal birth control, like the standard combined pill, works by preventing pregnancy through the suppression of natural ovulation.
By telling your ovaries to just go to sleep.
Yeah, it stops them from producing their normal fluctuating levels of natural estrogen. The synthetic hormones in the pill are enough to prevent pregnancy, obviously, but they often leave the body in an overall lowered state of circulating estrogen.
And the clinical term for this is a hypoestrogenic state.
Yes, hypoestrogenic.
And this is where the research gets incredibly jarring to me. Because this drop in estrogen, this hypoestrogenic state, essentially mimics what happens to the female body during menopause.
It absolutely does. The clinical guidelines from the Faculty of Sexual and Reproductive Health Care actually discuss this in the exact context of genitourinary syndrome of menopause, or GSM.
Genitourinary syndrome of menopause for people in their 20s.
Yes, GSM encompasses all the tissue changes we're talking about. The thinning, the dryness, the profound loss of elasticity.
So this is exactly why younger women on birth control are showing up at pelvic floor clinics with symptoms that look microscopically identical to a postmenopausal woman.
They are essentially experiencing medically induced menopause in their pelvic tissues.
That is, the psychological toll of that has to be massive. You're in your 20s, your body feels hollowed out, you've lost all friction, and nobody warned you that your birth control could age your pelvic floor by 30 years.
The lack of warning is a huge issue in pelvic health right now. Just look at the data we reviewed from the lowdown.
Right. The platform that tracks real-world contraceptive experiences from thousands of users.
Yeah, and the statistics there are staggering. 1 in 3 users reported vaginal dryness as a direct side effect of their contraception.
1 in 3. And when you read the anonymous anecdotes in that data, the connection to laxity is just unavoidable. Women are describing feeling like their body just gave up or feeling completely desensitized.
Because the pelvic floor muscles themselves haven't failed. They aren't mechanically weak. The tissue coating them has just changed character entirely.
It's like trying to grip something with a worn-out dry gardening glove instead of a sticky rubber surgical glove. The hand inside the muscle is just as strong, but the material on the outside has lost all its friction.
The friction is gone, and so is the padding.
Which naturally leads us to the question of risk. Because if suppressing hormones causes this sensation of laxity, I'm sure you are wondering right now if every single type of birth control does this.
Right, and they definitely do not all impact the body in the exact same way. We basically have to categorize them by risk level for inducing these specific tissue changes.
Let's start with the worst offenders then, the high-risk category.
So high risk includes combined oral contraceptives, the standard pill with estrogen and progestin. It also includes the Depo-Provera injection and etonogestrel implants, like the arm implant Nexplanon.
Because these rely on severe, continuous suppression of natural ovulation.
Yes. Even though the combined pill contains synthetic estrogen, its primary mechanism completely shuts down your natural ovarian production. But wait, it gets worse.
Of course it does.
Combined oral contraceptives trigger a secondary physiological response that makes the tissue problem even more severe. They heavily increase the production of a protein in your liver called sex hormone-binding globulin, or SHBG.
Okay, sex hormone-binding globulin.
Yeah.
If it's a binding globulin, it sounds like it's acting as a sponge, just trapping something in the bloodstream so the body can't even use it.
That is exactly what it does. It binds up free testosterone.
Wow.
And we culturally think of testosterone as this exclusively male hormone, but it is absolutely vital for female tissue health, lubrication, structural integrity, and arousal.
So with combined pills, the body takes a double hit. You get suppressed natural estrogen, and on top of that, Your testosterone is heavily bound up and unavailable.
Right. So the pill, the shot, the arm implant, those are very high risk for creating this sensation of laxity.
Okay, moving down the spectrum, we have the variable risk category. And this is primarily the progestin-only pill, which most people call the mini pill.
Yes. The clinical guidelines separate this out because of how it functions. Unlike the combined pill, the mini pill only suppresses ovulation in about 50% of cycles for the average user.
So what's it doing the rest of the time?
Its main mechanism is actually thickening cervical mucus to block sperm. It basically creates a state of hormonal roulette.
Hormonal roulette. How so?
Well, if you're in the 50% who continue to ovulate while taking the mini pill, your natural estrogen levels might remain perfectly stable. Your tissues will retain their thickness and elasticity.
Okay, but if you fall into the other 50%?
If you fall into the 50% where it does stop your ovulation, you are facing the exact same severe dryness, tissue degradation, and laxity as someone on the combined pill.
Wow. Okay, which leaves the low or no risk category. Because if you are listening to this right now and recognizing these symptoms in your own body, I want to be clear, is the only solution to throw your birth control in the trash.
No, you definitely do not have to throw away your protection and risk an unwanted pregnancy to fix your pelvic floor. There are options. The low-risk category includes the levonorgestrel IUD, which people know by brand names like Mirena.
Right, because the mechanism of action is completely different there.
Exactly. A hormonal IUD releases progestin locally, directly into the uterus, primarily to thin the uterine lining. The systemic absorption, the amount of hormone that actually makes it into your wider bloodstream, is incredibly low.
Because the hormone is localized, the ovaries stay awake.
Yes. The vast majority of people with a hormonal IUD continue to ovulate normally and produce normal levels of ovarian estrogen.
So systemic hormone levels stay pretty normal, which means the vaginal and vulvar tissues keep getting the estrogen they need to stay thick and bouncy.
Exactly. And of course, the absolute zero risk category for hormone-induced laxity includes non-hormonal methods.
Like the copper IUD or condoms.
Right. They introduce zero synthetic hormones, meaning they literally cannot disrupt your natural estrogen ecosystem.
Okay, so let's get into actionable solutions. If someone is currently on a high-risk method and they are feeling that distinct loss of sensation, what do they actually do about it?
Well, we have to unlearn some very bad advice first.
Oh, you mean the traditional advice given to women for decades anytime they mention the word loose?
Yeah.
Go home and do your Kegels.
Yes. Just squeeze the muscle. But based on the physiotherapy clinic insights in our sources, doing Kegels for this specific type of laxity is actually one of the worst things you can do.
Wait, really? But that is literally the only thing doctors ever say to you.
I know, but we have to view this through the lens of how the body responds to pain and vulnerability. We've established that this laxity is a tissue problem, right? It's not a muscle weakness problem.
Right, the fabric is paper thin, it's dry, and it's deprived of estrogen.
So when you have thin, raw, irritated tissue, the body's natural defense mechanism is going to kick in. It's going to panic and try to guard that vulnerable area.
By clenching.
Exactly. The pelvic floor muscles respond by spasming. They instinctively clench up to protect the irritated tissue, creating a hypertonic or excessively tight pelvic floor.
Oh, wow. So you end up with a painfully tight muscle layer sitting right underneath an atrophied, thinning tissue layer.
Yes, the irony is staggering. The birth control thins your tissue, which reduces friction and makes you feel loose. Your body panics because the tissue is sensitive, so your muscles actually clench up and get far too tight.
And then you go to the doctor, say you feel loose, and without even looking at the tissue, they tell you to go home and relentlessly squeeze an already spasming, over-tightened muscle.
Right. Doing Kegels on a hypertonic floor exacerbates the pain, worsens the dysfunction, and paradoxically makes the sensation of laxity feel even more severe.
Because you're just aggressively exhausting a muscle group that is already working overtime to protect you.
Exactly. You have to stop the Kegels.
So if Kegels are out, the actionable solutions have to address the root causes, right? We have to calm the spasming muscle and restore the thin tissue.
Yes. For the muscles, the physiotherapy clinics recommend specialized pelvic floor physical therapy, but specifically focusing on relaxation and downregulation.
And the biomechanical research highlighted a really interesting technique for this called hypopressives.
Yes. Hypopressives are an absolute game changer for this type of dysfunction because they do not rely on muscular clenching at all.
It's all about breathing, right?
Yeah, they utilize specific diaphragmatic breathing and postural techniques to alter the intra-abdominal pressure.
Right. So when you expand your rib cage using this specific type of breathing, Your diaphragm essentially acts like a plunger.
That's a great way to describe it.
It creates this vacuum effect in your abdomen that literally pulls the pelvic organs upward safely without you ever having to actively squeeze or bear down on the pelvic floor muscles.
And that vacuum effect builds resting tone and support while simultaneously allowing the pelvic floor muscles to finally relax and let go of their protective spasm.
So it resolves the hypertonicity without further irritating that raw tissue.
Exactly.
But okay, that only fixes the muscle spasm. The tissue itself is still starving for estrogen because of the birth control. How do we get the building blocks back to the hammock without compromising the contraception?
The medical guidelines point to local vaginal estrogen as the absolute gold standard treatment here.
Local estrogen. So this is applied directly to the vaginal and vulvar tissues.
Yes, in the form of creams, small tablets, or a localized ring. It provides the estrogen right where the receptors are begging for it.
Which restarts the production of type I and type 3 collagen and shuts down those destructive MMP enzymes we talked about.
Exactly. But I know the immediate concern for anyone relying on their birth control is whether adding estrogen is going to, cancel out their pill and lead to a pregnancy.
Right. That's the scariest part.
But the pharmacology of local estrogen is designed to prevent exactly that. It is absorbed solely into the localized tissues.
So it doesn't travel through the whole body.
No, the dosage is incredibly small, and it does not act systemically. It will not raise your overall blood estrogen levels, and it will not interfere in any way with the systemic effectiveness of your oral contraceptive or your implant.
Oh, wow. So if you feel loose or uncomfortable, you aren't broken. You can maintain your systemic protection against pregnancy while using a local cream a couple of times a week to completely reverse the tissue thinning.
Yes, and the guidelines also suggest using over-the-counter non-hormonal moisturizers.
Like just as a lubricant for intimacy?
No, actually used regularly, the way you would apply a daily face cream. It supports tissue hydration and comfort while the local estrogen does the heavy lifting of cellular repair.
That makes so much sense. So just to recap everything we've gone through in this deep dive, laxity is so frequently a sensation caused by changing tissues, not failing muscles.
Right.
And hormonal birth control suppresses the estrogen that keeps those tissues elastic, basically mimicking menopause. But it is entirely treatable with the right physical therapy, local estrogen, or a change in contraceptive methods.
Exactly. It's an entirely treatable condition once you identify that chemical root cause.
The relief in knowing that your muscles haven't just inexplicably given up is profound. Your tissue is just thirsty for the hormones it's being denied. A local cream or transitioning to a localized method like the hormonal IUD could literally change the cellular makeup of your pelvic floor and make everything feel normal again.
It really can.
As we wrap up this deep dive, I want to hand it over to you for a final thought. We've explored the biomechanics, the systemic hormonal effects, and the pathways to repair the tissue. What is the broader takeaway from all this source material?
Well, I want you to mull this over. We spend an enormous amount of time in society telling women that if they feel loose, unsupported, or uncomfortable in their own bodies, it is a personal structural failure.
Yeah.
We tell them they just need to work out harder, to be more disciplined, to do more Kegels. But think about how deeply our physical reality is driven by invisible chemical messengers. If a tiny pill taken every morning to prevent pregnancy can alter the structural integrity of your collagen, fire up enzymes that literally degrade your tissues, and completely change how your own body feels to you, what other physical sensations are you blaming yourself for that are actually just a side effect of a disrupted chemical ecosystem?
Wow. That completely reorients how you interpret what your body is trying to tell you. The next time you feel like your diagnostic landscape is murky, or a doctor tells you everything looks fine structurally, but you know it doesn't feel fine to you, remember that the fabric of your biology is complex and chemically driven. Don't be afraid to ask about the hormonal impact of your medications, and never accept "just do more Kegels" as the only answer to a problem they haven't properly diagnosed. Thank you so much for joining us on this deep dive. Keep asking the hard questions, keep exploring the science behind your health, and we'll see you next time.